We'll talk about sarcoma. Sarcoma arising from stromal cells. Okay, very very important. Sarcoma arises from stromal cells. So it is called as stromal sarcoma. Sarcoma can be arise from muscles. Then it is called as leiomyoma or leiomyosarcoma. Uterine sarcoma. WHO classification of uterine sarcoma. They have a leiomyosarcoma. There is a low grade endometrial stromal sarcoma. There will be a high grade endometrial stromal sarcoma. There can be undifferentiated uterine sarcoma. Okay, and adenosarcoma, picoma, that is perivascular epithelioid cell tumor. It is a malignant variance, that is gene mutation is TS gene mutations is there. Okay, TS gene mutations. Then histological type of uterine carcinoma. In histological type, you can see there will be a leiomyosarcoma. Again, the leiomyosarcoma, based on the histology, we have divided into four types, that is not otherwise specified, or it can be spindle cell. If there is spindle cell, there will be a conventional, that is the conventional leiomyosarcoma, that is spindle cell leiomyosarcoma. Then you can get a epithelioid leiomyosarcoma. Then you can get a mixed leiomyosarcoma. Okay. Then in histological grading, there will be a same as WHO classifications: endometrial stromal sarcoma, that is low grade types, or endometrial stromal sarcoma, that it can be high grade types, or undifferentiated sarcoma. Then you can get adenosarcoma, not, and in adenosarcoma again they are divided into not otherwise specified. Again with sarcomatous overgrowth, you can get rhabdomyosarcoma. I told that malignant variant of picoma, perivascular epithelioid cell tumors. Then we'll see the staging. In FIGO staging, stage 1, the tumor is limited. Tumor in the leiomyosarcoma, in the stage 1, you can see the tumor is limited to the uterus. Tumor is limited to the uterus. Again, the stage 1, they have divided the leiomyosarcoma based on the size of the lesion. If the tumor size is less than 5 centimeter, or equal to 5 centimeter in the greatest dimension, then it is called as stage 1A. Very, very important. Then if the tumor size in the greatest dimensions, if it is more than 5 centimeter, it is called as 1B. Less than equal to 5 centimeter, if it is more than 5 centimeter in the greatest diameter, is called as 1B. Very very important points. In the stage 2, stage 1 already I told. In the stage 1, tumor is limited to the uterus. Stage 2, tumor extend beyond the uterus, but the tumor is limited within the pelvis. Again, the stage 2 have divided into stage 2A and stage 2B. Again, the 2A and 2B, how you will remember? It is limited to the uterus is stage 1 if the size of the tumor mass, if it is a less than 5 centimeter, less than 5, or more than 5. Okay, less than equal to 5 or more, less than equal to 5, it is 1A. More than 5 centimeter, 1B. Again, the stage 2, tumor is beyond the uterus. Now the tumor is going outside the uterus. If it involves the adnexa, suppose this is the uterus and adnexa. This is the uterus and adnexa. This is the adnexa. If tumor is spread to the 2A is telling tumor is spreading to the adnexa. Unilateral. It can be unilateral. Tumor is spreading the unilateral or bilateral adnexal involvement. Then 2B is telling tumor is spread extrauterine pelvis excluding the adnexa. Extrauterine pelvic tissue. Now the tumor is in the 2B, the tumor has spread to extrauterine pelvic tissue. Extrauterine. So it is outside the uterus. These are the pelvic tissue. If the tumor is spreading to the outside the extrauterine pelvic tissue, that is 2B. In the stage 3, tumor has infiltrated the abdominal tissue. Suppose as in the stage 3, it will extend to the abdomen. Okay, this is the abdomen. This is the abdominal organs. You can see the bowel. This is the stage 2, bowel ho gaya. You can see the stage 3. This is stage 3, bowel, abdominal organ. Again the stage 3, they have divided 3A, 3B, 3C. If it one side, suppose one side or any one points, any one locations, if it is more than one side, 3B, then 3C, metastasis to the pelvic lymph nodes. Remember, pelvic lymph nodes, these are the pelvic lymph node. You can see pelvic lymph nodes, pelvic lymph node if involved, pelvic lymph nodes or para-aortic. This is the aorta, this is the aorta that is involved, then it is called as para-aortic lymph node. Pelvic lymph node stage 3C. Pelvic lymph node is stage 3B, 3C. Pelvic or para-aortic lymph node, it is stage 3C. Then in stage 4, tumor has infiltrated the bladder. Remember here the bladder, you can see the bladder will be here. Okay, if bladder is involved, then it is, then here the rectums. Okay, rectums. If bladder is involved, then this stage 4A, and or rectums, if it is rectums also involved, it's called as 4A. Any other distance metastasis is called 4B. Very, very important, very, very easy to remember. First, you can see the, if tumors is limited to the uterus, that is stage 1. Okay. Again, in the stage 1, they have divided into 1A and 1B. In 1A, if it is the size, if you see the size, if less than 5 centimeters, less than or equal to 5 centimeters, stage 1A. If it is more than equal to 5 centimeters, more than 5 centimeters, this stage 1B. Again, then stage 2, the tumor has to involve outside the, beyond the uterus, outside uterus, but within the pelvis. But without the structure in the pelvis, there will be adnexa or there will be a pelvic parametrial tissue. So if you involve unilateral or bilateral adnexa, then it will stage 2A. If it is involve the pelvic parametrial tissue, then it is stage 2B. Excluding the adnexa has not been involved in the 2B. Then in stage 3, I told 3A, 3B, 3C. Stage 3, that has to be involved the abdominal tissue outside the pelvis. Then if it is involved one side, then it's stage 3A. If it is two side, more than one side, there is 3B, 3C is pelvic and para-aortic lymph node. Stage 4 involved to infiltrate the bladder and rectums. If the bladder and rectum involved, then stage 4A. If it is 4B, then it is distance metastasis. Okay. Then adenosarcoma. Here this is a leiomyosarcoma. They have divided definitions. The adenosarcoma, they have different staging. In adenosarcoma, tumor is limited to the uterus. Tumor is limited to the uterus. Tumor limit in stage 1A limited to the endometrium, endocervix without myometrial infiltration. Very, very important. In the adenosarcoma, tumor is limited to the endometrium. Here the endometrium, one name endometrium and endocervix. You can see the cervix. Endocervix is involved without myometrium. Here tumor is involving in the downward directions. Very, very important. Not infiltrating the myometrium in the 1A. In one way, it has infiltrated less than half of the myometrium. If it is less than half, in 1B, if it is involved less than 50% of myometrium, then it is 1B. In the 1C, it is more than 50% of myometrium. This is 1C. This is 1C. Okay. More than 50% of myometrium, 1C. Then in the stage 2, tumor spread to the pelvis. Tumor in the stage 2, again 2A, 2B. 2A is tumor has spread to the 2A, involve the adnexa. Okay, it is here the adnexa. 2 adnexa. Tumor has unilateral adnexa or bilateral adnexa. And then 2B spread extrauterine pelvic tissue, excluding the same. Here the 2 is same, but 1 is slightly different from the leiomyosarcoma staging. In the leiomyosarcoma, compared to the leiomyosarcoma, the adenosarcoma staging is different. In the type 1, that is tumor is limited to the endometrium or it is extension. The adenosarcoma extends. Adeno means gland. Gland has to be extended toward the cervix. The glandular tissue is more toward the cervix. No, so it is the growth toward more toward the cervix. So tumor is 1A. Tumor is limited to the endocervix, endometrium without myometrial involvement. 1B is less than 50% myometrial involvement. 1C is more than 50% myometrial involvement. In the stage 2, same as that of leiomyosarcoma, is spread to the pelvis, that is extra uterine tissue, but within the pelvis, involved with the adnexa, unilateral adnexa or bilateral adnexa. It can be involved unilateral or bilateral adnexa. In the stage 2B, B has to spread to the extra pelvic, extra uterine pelvic tissue, excluding the adnexa. Then 3 I all the same as intra-abdominal spread, that is one, same as adenosarcoma, leiomyosarcoma. If it is one side, if it is abdominal organs, if it is a bowel, I draw some bowel. If it's on one side, if it is more than one side, then it's 3B. 3C is metastatic pelvic lymph nodes, pelvic lymph node, pelvic lymph node. This is pelvic lymph node and para-aortic lymph nodes. It's 3C. Okay, then stage 4 is same. Tumor has infiltrated the bladder and rectal mucosa. Stage 4, bladder and rectal mucosa. If it is involved, the bladder and rectal mucosa, the tumor involved, then it is stage 4A. Then stage 4B is this metastasis. So very simple to remember the leiomyosarcoma staging versus adenosarcoma staging. Okay, the only one difference, tumor is here in the stage 1 is different. One is the size. In leiomyosarcoma they mention the size of the lesion is less than 5 centimeter, more than 5 centimeter. But here you can see the adenosarcoma. Adenocarcinoma is more towards the endocervical growth. The growth tumor is limited to the endometrium. It is a growth towards the endocervix 1A, and without myometrial infiltrations. 1B is infiltrations started. 1B is less than 50%. 1C is more than 50%. The rest 2 stage 2 tumor spread to the pelvis without if it is involved the adnexa, unilateral, bilateral. Then stage 2A. If it is stage 2B, then extra excluding the adnexa, it can involve the parametrium. If it is then stage 3, starting from the intra-abdominal spread, 3A, 3B. 3A is one side, 3B is two sides, 3C is metastatic pelvic and para-aortic lymph nodes. Stage 4, it is involve the bladder and rectal mucosa, and stage 4B the distance metastasis.